Hey guys, Dr. Hunt again at Hunt Physical Therapy. Today we're going to talk about pain in the temporomandibular joint, also known as the TMJ. So what are some of the causes of pain in that joint? Postural stress has been attributed to that, having that forward head posture. That causes what's called a malocclusion. Essentially, the upper and lower jaw, they don't meet symmetrically, and so that can cause wear and tear on that joint. Another big one is grinding your teeth, clenching your teeth, primarily at night. That's the thing that the dentists make the night guard that you put in at night, and that really helps dissipate some of the forces from grinding your teeth. I have found in my practice, even with that night guard, a lot of times people still have pain in that area, and I find what's called a trigger point. We've talked about these before. Essentially, a trigger point is just a really painful knot in a muscle, but they'll have a trigger point in a muscle on the inside of the mouth called the medial pterygoid. So it's a real important muscle for chewing. A lot of times when you have a trigger point there, in addition to pain in the TMJ, you can get headaches. You can also get pain opening and closing your jaw. And so before I do this technique on myself, I'm going to show you how to do it. In the clinic, obviously we use gloves, but I'm not going to use one since it's my mouth. So at home you do what you want. But essentially take your fingers like this in a pincher motion. The index finger is going to go inside your mouth, and you're just going to kind of feel along the wall of the mouth until you reach the very back where the upper and lower jaw meet. If you drop off just to the front of that, you'll land on the trigger point if it's there, and it'll be really sensitive. And so what you're going to do there is called ischemic pressure release. And so you're just going to push down on that knot as hard as you can stand it. Sometimes it's useful to move your fingers just a little bit like that. Hold for 60 to 90 seconds, and you can do this each day. So here we go. That's it. Another big one that you can do at home is just watch your posture. So between this and that, these two things, watching your posture, do this a few times a day, once a day, whatever, you'll find a lot of times that pain in your TMJ joint is significantly reduced. I've seen patients in the clinic just after one treatment session, they notice a huge reduction in their jaw pain. So try those things at home. I appreciate your time. If you like, please subscribe. Feel free to leave comments below, and we'll see you next time.